High blood pressure, or hypertension, is a common health issue affecting millions of people worldwide. Many diets are recommended to help control and lower blood pressure, with the DASH diet and the Mediterranean diet being among the most popular. These diets typically emphasize reducing salt intake, limiting fat consumption, and increasing carbohydrates from vegetables and whole grains. However, many people find these diets difficult to maintain long-term because the human body actually needs a certain amount of salt and fat to function properly. Excessive salt restriction or fat limitation can lead to fatigue, discomfort, and frustration, causing people to give up. Additionally, the blood pressure reduction achieved by these diets is often modest, usually only lowering blood pressure by about 2 to 3 points, which may not be enough to bring blood pressure back to a healthy range. Moreover, strict portion control and calorie counting required by these diets add extra pressure, making it hard for many to stick to them consistently. After a few weeks or months, people often feel discouraged and blame themselves for not succeeding. Therefore, finding a diet that is both effective in lowering blood pressure and easier to follow is essential. Emerging approaches focus on consuming a low-carbohydrate, whole food diet that includes adequate fats and proteins and allows for salt intake according to taste. These methods have shown promising results in helping people reduce their blood pressure more significantly and maintain better overall health. If you're looking to manage your blood pressure effectively, consider trying a diet that is less restrictive but still supports sustainable health improvements over time. Two of the most commonly recommended diets for people with high blood pressure are the DASH diet and the Mediterranean diet. However, both come with significant limitations. The DASH diet emphasizes very low sodium intake, low saturated fat, and high carbohydrates. Yet, drastically cutting salt is challenging for most people because the human body naturally needs salt to maintain normal physiological functions. Just as it's impossible to reduce your breathing rate to 5 breaths per minute since the body is programmed to breathe 14 to 20 times per minute, severely limiting salt intake is similarly unsustainable. The modern Mediterranean diet, although widely considered healthy, is quite similar to the DASH diet in being low in salt and fat but high in carbohydrates. Eating large amounts of fruits, vegetables, and whole grains, common in this diet, can sometimes cause blood pressure to rise rather than fall. Research shows that both of these diets tend to lower blood pressure by only about 2 to 3 points, a very modest improvement given the effort required. Another major drawback is that both diets emphasize portion control and calorie counting, which can create stress, lead to hunger, and result in many people failing to stick with the plan after just a few weeks or months. Often, individuals blame themselves for not succeeding, when in fact the advice itself does not align well with human physiology and natural eating habits. Because of these challenges, following these diets long-term can be very difficult and often fails to produce the desired health benefits. This highlights the need for alternative approaches that better support people with high blood pressure in achieving sustainable results. A low-carbohydrate, whole food diet has shown promising results in managing and even reversing high blood pressure. Unlike the DASH and Mediterranean diets, this approach allows for adequate salt intake and focuses on reducing carbohydrate consumption to around 50 grams or less per day. Some individuals may benefit from even lower carbohydrate levels, such as 20 grams per day, but starting at 50 grams is a practical approach to see how the body responds. This diet emphasizes eating 2 to 3 well-balanced meals daily, primarily consisting of fatty meats and vegetables, salted to taste. The goal is to eat until comfortably full, rather than counting calories or strictly controlling portions. This way of eating helps regulate hormones like insulin, cortisol, and aldosterone, which play key roles in blood pressure and inflammation. One important element of this diet is avoiding snacking between meals and practicing intermittent fasting, ideally fasting for at least 16 hours per day. While this may seem difficult at first, it becomes easier as meals contain more fat and protein, which increase satiety and reduce hunger between eating periods. By lowering carbohydrate intake and improving hormonal balance, this diet helps reduce chronic inflammation and excess fluid retention. The kidneys can then more effectively remove excess fluid, lowering blood volume and, consequently, blood pressure. Clinical experience has shown that many people can significantly reduce their blood pressure on this diet, sometimes dropping by 20 or 30 points. Some individuals have even been able to reduce or stop multiple blood pressure medications. Overall, this low-carb, whole food approach provides a more sustainable and effective alternative for people struggling with hypertension compared to conventional low-fat, low-sodium diets. If you've tried low-carb, keto, or carnivore diets and successfully lowered your blood pressure or even stopped taking medications, sharing your experience can be invaluable to others. Many people are hesitant to try these diets because of fear fueled by misleading news or misconceptions. Hearing real success stories can encourage them to give it a try for a month or two, which is often all it takes to see meaningful improvements. When starting this approach, it's important to commit to eating whole foods low in carbohydrates, focusing on fatty meats and vegetables, and allowing yourself to salt your food to taste. Avoid snacking between meals and aim for at least 16 hours of fasting daily. This helps keep insulin, cortisol, and aldosterone levels low, reducing inflammation and fluid retention, which are key contributors to high blood pressure. As your blood pressure begins to improve, you may find yourself able to reduce or discontinue some of your medications under the supervision of your healthcare provider. This is a positive sign that the diet is working. If you have experienced such benefits, consider leaving a comment about your journey. How many medications you were on before, your average blood pressure, and what changes you saw after starting this diet. Sharing these stories not only helps build a supportive community but also provides real-world evidence that can motivate others. Additionally, sharing this information with friends or family members who have high blood pressure could potentially change or even save their lives. Spreading awareness about effective, sustainable ways to manage hypertension is a powerful step toward better health for many. Taking control of your diet and lifestyle is empowering. It can lead to lasting improvements and a healthier future. Managing high blood pressure effectively requires a diet that aligns with the body's natural needs and promotes long-term health. Traditional recommendations like the DASH and Mediterranean diets, which emphasize low salt and low fat intake, often fall short. They can be difficult to maintain and typically result in only modest blood pressure reductions. In contrast, a low carbohydrate, whole food diet offers a more effective and sustainable solution. By allowing adequate salt consumption and focusing on healthy fats, proteins, and minimal carbohydrates, this approach supports better hormonal balance and reduces chronic inflammation. This, in turn, helps the kidneys eliminate excess fluid, lowering blood volume and blood pressure. Adopting this diet involves eating 2 to 3 satisfying meals daily, avoiding snacks, and practicing intermittent fasting with a goal of 16 hours without eating. This pattern helps keep insulin, cortisol, and aldosterone levels low, which are important for healthy blood pressure regulation. Many individuals who follow this diet report significant improvements, including reductions of 20 to 30 points in their blood pressure. Some have been able to reduce or stop multiple blood pressure medications under medical supervision. Sharing personal success stories can inspire others to try this approach without fear or hesitation. It's important to remember that no diet is one size fits all, but experimenting with a low-carb, whole food plan may offer substantial benefits for those struggling with hypertension. Ultimately, taking control of your diet and lifestyle is a powerful step toward better health and improved quality of life. If you or someone you know is battling high blood pressure, consider exploring this approach and consulting with a healthcare professional to tailor the plan to your needs. In summary, managing high blood pressure effectively goes beyond traditional low-salt, low-fat diets. Embracing a low-carbohydrate, whole food approach that allows for adequate salt intake and focuses on healthy fats and proteins can offer greater and more sustainable improvements. This method supports hormone balance, reduces inflammation, and helps the body naturally lower blood pressure. While every individual's needs may vary, adopting this lifestyle, with mindful meal timing and no snacking, can empower you to regain control of your health. Consulting a healthcare professional can help personalize this strategy for the best results. Take the step toward a healthier future today.